There have been 10 cases of Ebola within the United States. 6 cases where an American citizen was infected abroad and brought back to the US for treatment, and 4 cases where Ebola unintentionally occurred within the United States. These 4 widely publicized cases sparked widespread fear about an Ebola outbreak spreading into communities in the US. But while caution is needed in dealing with deadly diseases, many of these fears are not based in fact. To combat this, let's look at how pandemics have worked historically, some of the risks of a pandemic today, and the implications of truly understanding pandemics. First of all, according to the Merriam-Webster dictionary, a pandemic is any disease occurring over a wide geographic area and affecting an exceptionally high proportion of the population. In order to become a pandemic, a disease must both be contagious enough to become widespread on a continental or global level, as well as lethal enough to be a serious global concern. But when the CDC names a disease, such as a flu strain pandemic, it also implies a new strain of disease. According to the CDC's website, updated July of 2014, a flu pandemic occurs when a new strain of virus evolves for which humans have little to no prior immunity. Almost every disease historically referred to as a pandemic meets these 3 criteria: new, contagious, and lethal. Smallpox was a deadly disease with a 30% mortality rate. It could be spread through direct contact or through contact with an object contaminated with fluid or scabs. In some cases, it could also be spread through air in enclosed spaces. It was especially deadly to the populations of North and South America who had never encountered it before. The deadliest pandemic in human history, the Spanish influenza outbreak of 1918, also fits these 3 criteria. It killed an estimated 50 million people in 2 years. And, as many flu viruses, it could be spread through direct or airborne contact. It didn't have as high of a mortality rate as smallpox, but it became the deadliest pandemic in human history because it was so contagious and because it had opportune timing in outbreaks spreading it across the globe in the final years of World War I. Modern research shows that the Spanish influenza virus was an H1N1 type virus, possibly the first of its kind. Today, many flu viruses share characteristics and may have descended from this deadly disease. When looking at smallpox and Spanish influenza, we can see that historically pandemics have been new, contagious, and lethal. In order to become a pandemic today, a disease would also have to meet these 3 criteria. But with modern medicine, the scientific community would also have to be underprepared for the disease. In order to demonstrate this, let's look at 2 diseases with a high pandemic potential: Ebola virus disease and a newly evolved strain of influenza. According to statistics from the World Health Organization, presented in October of 2014, Ebola has a 70% mortality rate, making it an extremely deadly disease. But it can only be spread through direct contact with a patient or their fluids. Currently, Ebola is not airborne. It cannot survive on surfaces for very long, and it is only contagious once its victims begin to show symptoms. Today, there are no FDA-approved vaccines or medications, but there is ongoing research and testing of multiple Ebola-specific treatments. This includes the experimental use of antibodies from recovered victims in currently suffering patients. So because of modern medicine and prevention techniques, Ebola is a very serious disease that has become an epidemic, but not a pandemic. Another disease with a high pandemic potential is a newly evolved strain of influenza virus. Flu viruses are generally very contagious and spread through airborne contact. But humans have developed natural immunities as well as vaccines to combat many strains. The real risk comes when a new strain evolves from affecting an animal population, such as a swine or avian flu, to infecting and transmitting between humans. But this disease would have to evolve and spread extremely quickly in order to outpace global efforts to monitor and combat new flu strains. So, though influenza is a powerful disease, it also fails to meet the 4 criteria to become a pandemic. Understanding diseases helps stop their spread. This is true on a global and personal level. Globally, the World Health Organization has the Department of Pandemic and Epidemic Diseases, or PED, which is dedicated to combating pandemics and their smaller cousins, epidemics. PED helps countries prepare for an epidemic, assesses diseases with high epidemic or pandemic potential, and conducts field research of epidemics, and then provides this information to policymakers. PED also manages global mechanisms to help combat disease and prioritizes healthcare for those affected by pandemics or epidemics. Like our global response to diseases with a high pandemic potential, our medical technologies have advanced significantly. Our understanding of sickness not only allows us to effectively treat symptoms, but to come up with new vaccines and treatments during an epidemic. Hospitals within the United States are able to take extreme precautions in preventing the spread of disease. These range from personal protective gear, such as gloves, masks, gowns, even full suits. It also has proper disrobing and disposal techniques, and negative pressure rooms. Negative pressure rooms are a patient's room with a set of double doors that never open at the same time, and its own designated ventilation system, which always pulls air out of the patient's room. When someone enters or leaves the room, the air from between the doors is pulled into the room, making sure that no airborne particles can escape to the rest of the hospital. But there are limited numbers of patients who can be treated under these conditions. Our healthcare system is designed to fight diseases before they become pandemic, which is why an informed public is so crucial. Following the cases of Ebola within the United States unintentionally, there were many responses of panic, and panic can lead to rushed, sometimes regretted decisions. In a democracy, the public has a large say in what policies the government will implement. Therefore, an educated public, one that understands diseases, pandemics, and the current efforts to combat them, would have a much more productive impact in making policies to help stop their spread. In the months following the Ebola cases, we've seen some backlash against those who are overly concerned, with comments such as, "You're more likely to die from the stairs," from alligators, from the bathtub, or from cow-related injuries than from Ebola. And while Ebola has claimed very few lives in America, we still do need to realize that it's a serious disease that has claimed thousands of lives in Africa. It's very important that individuals understand the severity of a potentially pandemic disease and comply with the policies in place to help stop its spread. So, by understanding diseases on a global and personal level, we can help stop their spread. Today, we delved into pandemics. We discussed their dictionary definition, a disease that occurs over a wide geographic area and affects a high proportion of the population. We've seen that historically, pandemics have had the three criteria of being new, being very contagious, and being very severe. We can also see that in modern times, a disease would need to overcome the efforts by the scientific community in order to become a pandemic. And currently, neither Ebola nor a strain of influenza has crossed this threshold. And hopefully, with further understanding of pandemics and diseases at all levels, they never will.